the podcast where we explore the crucial role of healthcare supply chain. I'm Dana Trampas, your host. Each episode is a new chapter in the exploration of best practices, innovations, and advancements, ensuring that at the end of the healthcare supply chain, we prioritize the most vital element, human life. And understanding the people behind each link in the healthcare supply chain is crucial, which is why I am incredibly excited for our guest here today. Can you tell our listeners a little bit about yourself, your background, and what motivates your work in healthcare supply chain?
I am a retired nurse, an academic. Well, I was registered as a nurse for over 50 years and had experience in working in academia, in health policy at both the provincial and the federal levels, and also a number of years in clinical practice. A lot of my work has been done on health human resources and interprofessional collaboration and patient safety. So these are all things that I bring to the supply chain discussion that I think are valuable, because I think of health human resources as part of the supply chain because they're at the sharp end of the actual delivery of whatever products we are using.
You have quite an extensive clinical background. So what ways does a clinician interact with the healthcare supply chain in their daily work? Can you paint us a little bit of a picture of what that looks like or had looked like for you in your career?
Well, I think for most clinicians, the supply chain is invisible and taken for granted.
Yeah.
You
Yeah.
just assume that you're going to have the right supplies when you need them to carry out clinical care. I guess the closest you would get to it is if you have to order something that is unique to your unit or to the care process that needs to be provided, and you have to order that up specially from central supply. Or if something changes and central supply communicates that product that you have been using is no longer available and you have to switch to something new. In between that, I would say that the supply chain is a black box for most clinicians.
Why do you think clinicians should care about the healthcare supply chain? How can you connect the dots there to make them understand and care about it and how it impacts daily patient care and practice?
The only time that people really become aware of supply chain issues is when something is not available. When you hear that there's a drug in short supply that you can't access, or a piece of equipment. And then it becomes really important, because I think most people who are non-clinicians don't really understand how the human technology interface works in terms of your daily life. We all use tools, and those tools are part of your performance of a task, for example. And it's very complex, this interaction between the human technology bits of the job. So I recall in my history, this goes back a long way, when a particular supplier of an IV cannula had lost the contract, and there was a new supplier coming in, and all of a sudden we have these new IV cannulas. And when you're starting an IV, there's a certain feel to when you're in the vein.
Yeah.
And with the new cannula, the feel was different. It wasn't, it's not that it's good or bad, it was just different. And so when I would normally have been able to start an IV in one try, initially with the new product, it took me 2 or 3 tries. And you feel badly because the patient's getting poked more often than you would like. And it's that subtle difference about working with a different piece of equipment. So I think we're aware of it when something happens that makes it different, but we don't always think of it day to day. We kind of take it for granted. And I think the most recent experience around the supply chain was during the COVID-19 pandemic, when all of a sudden things that you took for granted being available were not there. And what happens then is that as clinicians, you have to figure it out. You have to MacGyver it. You have to decide, how are we going to carry out a care process when we don't have the equipment that we normally would have, like personal protective equipment. And then that takes time out of your very busy day to figure out, okay, how are we going to do this differently? And then communicate that to the rest of the team.
I think that was interesting you brought up about the IV. I have a friend who's was in nursing in the States, and we had conversations about healthcare supply chain. And she said, I never really thought of this, but she said a lot of times we would have favorite IV lines that we would hide on the shelf because it was reliable and et cetera. And she's like, I never really put the pieces together that that was part of it, and or a favorite PPE or whatever that they like, and that because of scarcity, they would hide it on the shelf in a certain spot that only they could find. So I feel you on that story.
Yeah, but it's something that we non-clinicians might not necessarily be aware of. Whenever somebody is doing a complex procedure, you get used to a certain piece of equipment and how that feels, and it's an extension of your fingers and your brain, and
Yeah.
all that goes into actually carrying out that task.
You got to be able to have these tools in order to provide excellent patient care. But I'd like to go back a little bit. I know that you have quite an extensive nursing history, many contributions to the field. What have you seen and or experienced in the evolution of healthcare supply chain influencing the nursing profession? Like what kinds of things may have you seen over the years or experienced?
I think the main difference that I've seen is the move to just-in-time supply provision. What this means is that you have what you need when things are normal, but if you have something happen that you need extras or there's a surge in a particular need for a product, often that creates a problem. What we probably need to really shift in our thinking is from just in time, which is fine when you've got a predictable activity going on, but in healthcare things can always change and never be predictable, and then you need something that you don't have on hand. An example is you have a med surge patient on a regular inpatient unit, and suddenly they're deteriorating, and the doctor wants to do a lumbar puncture to see whether there's something going on with that patient. That's a special kit have to be ordered up, and then you'd have to make sure that you have all the right people there, the doctor and the nurse and everybody ready, and the equipment and the patient prepared. It's a procedure that's uncomfortable and patients dread it. And
Mm.
so there's all of that stress for the patient. And if the equipment can't come at a particular time and the thing gets delayed, everybody's work processes are out of sync. And it's particularly stressful for the patient. So just in time works fine, I think, in some industries, but I'm not sure it works well in healthcare. And I think we really need to shift to a just in case thing. We are thinking ahead of what would happen if X happened. What kind of supplies would we need to have? And how soon would we be able to get them? And these kinds of things would be in an emergency department, but not necessarily on a regular inpatient unit, where we can't assume that every patient that comes in has the same course in terms of their illness and their treatment. Things happen.
You talk quite extensively about being prepared, right?
Mhm.
Anticipating these. And I think part of that is nursing education, which I know you have a lot in your background.
Mhm.
Is there any way that nursing curriculum could better prepare nurses or clinicians to navigate these? Like whose responsibility is it to kind of lead the charge? And is there any way in nursing curriculum that could help that process?
Well, as an educator, you'd like to prepare your students for everything, but that simply isn't possible. And nursing curricula are completely jam packed. We add things, but we rarely take things out.
Mm-hmm.
So I would say this is not something that I would necessarily put in a nursing curriculum, but I would put it process for onboarding new staff, particular practice setting. When we're onboarding people, new hires, whether they're new grads or they're experienced people, there are things they need to know about this particular context of practice. And I would say really alerting people to how the supply chain works from the time products are delivered to the door till it gets to the unit and you use it is important for all clinical staff to be aware of and to know.
Are there any measures nurses can take to ensure that patients receive the best possible care despite a supply chain challenge? What is there any advocacy or
Mhm.
work that they could possibly do to influence that?
I think that's an excellent question because I think where I come from on that is that we prepare clinicians, no matter what discipline they're in, to be patient centric. They care about patients and they care about the care that they deliver. So I would see the pressure point there being on leadership and on policy and on funders to make sure that they're supporting clinicians so that they can deliver the care that they want and should be delivering. At that level, I think this is where the just in time shift to just in case thinking kind of goes in. What are we doing to ensure that we have surge capacity, that we can respond to unusual circumstances? And then how do we support our personnel? They're able to do the job that they were prepared for. So when there's a shortage of something, who needs to know this? And how do they engage the staff and the healthcare personnel and the professionals in the organization in in decision making when it's appropriate? I mean, there are some things that you're just going to substitute, and sometimes it's just for a short period of time, and it's negligible in terms of the impact. But there are other things that really do have an impact on the clinician's ability to be able to do their job. And in those situations, you need to involve the right people in deciding what are we going to do about this and how are we going to integrate it into the care processes and ensure that we're still delivering safe quality care to our patients. And that's where I think things like professional clinical councils and committees and processes like that can help to engage people. We don't want everybody to get too much information. When COVID hit, people were deluged with information sometimes, and it was kind of a balance between too much and too little information. It was hard to ensure that you had a credible source, with clear messaging on things. The PPE was a great example where there were all kinds of mixed messages coming to clinicians about how long you could wear a mask and whether you could wear the same mask between patients. And then patients, of course, were on social media getting all kinds of non credible information and
Yes.
coming into the healthcare settings with their particular view of what the situation was. So we have to be very, I think, careful to involve communications people within organizations on designing good communication processes, and then the leadership deciding what's important and when do we need to engage clinicians in the decision making.
I love that education and messaging that all plays a huge integral role in healthcare, whether you're uh, part of the workforce or you're a patient receiving care, the way that we communicate things is huge. But how do we measure success? How do we know that we're doing things right? And does it look different for different key players in healthcare? What does it look like?
Each organization has unique structures and processes within it. There are certain elements I think we should be required. And one of them is you need to have an ethical decision making framework in place in advance that guides decision making in a situation of shortage, that will actually support clinicians in making decisions. Examples there is, when you add to nursing workload, like in a situation with COVID, for example, if you're not a clinical person, you probably aren't aware that with each patient contact, the nurses had to disinfect and gown and mask and glove, and then undo that after before they prepare to see the next patient. And that all takes time, and then time becomes something that you have to ration. How much time can I spend with this patient, knowing that I have these other patients that also have needs that I have to meet. And so how does the organization support clinicians in that ethical decision making about rationing actual care time, right? And there should be clinical governance structures in place that support clinicians to access information and have input to decision making. There's clear leadership and accountability for responding to and communicating supply chain disruptions. That needs to be in place, that everybody knows who communicates and who's accountable. Health professionals do need to have what they need to provide safe care. And in some cases, that can be going back to lower level technology, but you have to engage health professionals in deciding how to do that. And clinicians need to be able to trust leadership to make good decisions and seek input from clinicians when that's needed. And then I think most importantly, we shift from just in time thinking to just in case thinking. I think those are probably the key elements.
Trust and transparency are vital.
Read a bit on that because, as somebody who did a lot of work on health human resource planning in my career, what happened during COVID with the unidirectional top-down communication about how to use personal protective equipment that a lot of clinicians felt was not consistent with safe practice and felt at risk for themselves and for their patients and also for their families, is that people did lose trust in leadership. And I think that's playing out now in the staffing problems that some organizations are having. So very important that people in leadership positions can ensure that trusting relationship, that sort of psychological contract, is maintained and preserved. And I think that was where things fell down.
I think that in anything that happens, you need to have a nurse at the table to discuss experiences and what's going on. So often is leadership not in touch with what things are happening at the front lines. So I always advocate when anybody ever asks me advice, I say you need to make sure that you have a nurse on your team or on the leadership to kind of be in touch with what's happening on the front lines. If you had a crystal ball and you could see into the future in the next decade, how do you see healthcare supply chain evolving and how does that impact clinicians?
Well, I'm hoping that we move away from thinking just in time and lowest cost to how do we create redundancies in the supply chain so that we can be nimble and respond to these surges that occur because of things that happen in the environment. And that can be an environmental disaster, it can be warfare, it can be a pandemic. All of these things affect demand on healthcare, and then in turn, they affect demand on supply and the burn rates that you have on supplies. So, what are we doing to really think about what would happen? We should be doing tabletop exercises, I think, periodically to think about, okay, let's decide what would we do and how would we respond and what are the redundancies and the alternatives in the system that would allow us to respond effectively. And I think remembering that, when you're talking about having nurses at the table, well, yes, but maybe depending on the circumstance, it's not a nurse. It could be somebody else that needs to be involved in that. There are some contexts in which, finding a substitute for a particular product or a drug or a biomedical device would be extremely difficult, if not impossible. And then you probably really need to involve a team in deciding how are we going to address this particular challenge. So I think just in general, thinking about the healthcare professionals that are trying their best to deliver care, that we don't want them to experience moral injury and moral distress because they cannot meet the needs of the people that they're responsible for providing care for, that we're supporting them, that we're engaging them, and recognizing that in the healthcare supply chain, that healthcare provider is at that sharp end when the care is actually delivered. And we need to think about the health human resources as part of a supply chain, not ignored when we're thinking about supply chain disruptions.
It's very much an interdisciplinary collaboration, right? It's
Very
going to
much.
take all of us to make this happen, right? It's not one of us, it's all of us.
We have wicked problems that we're dealing with, and there isn't any one way to respond to this. I was interested in reading something the other day about putting hacking teams together to
Yeah.
you have a particular problem and you pull in a bunch of people who potentially would have expertise in that area, and you just say, here, focus on this problem and come up with some ideas around how we could work with this. I love the idea of putting hacking teams together to figure out, how are we going to build redundancy? How are we going to deal with substitutions? Who needs to know about this? How do we communicate it? It's a complex problem, and we need more minds, as many minds, I think, as possible to be able to respond effectively.
So what is a call to action we can put out there now? What do you hope that people are left with from today's discussion? What call to action can we put out in the universe?
Okay, for clinicians, you need to know about supply chain.
Yeah.
I know it's invisible, but you need to know about it and how it works and how that impacts you. For leadership, how do we ensure that we have redundancy in the system and that we can support clinicians when something happens that disrupts the supply chain? How can we influence funders and decision makers and policymakers to ensure that they're supporting us, that we have those things in place? And do we have the leadership skills to support people in our organization in a crisis? That we can ensure that people still have a sense of trust in leadership, that they're getting the right information, and that they can act in a situation. And I think we need to look at this in terms of all these different layers of people in the system. Who needs to know? When do they need to know it? When do we need to engage people in problem solving?
Well, Kathleen, I want to thank you so much for your time today. If you enjoyed today's episode, don't forget to share your thoughts and feedback. And until next time, I'm Dana Trampas, your host. Stay tuned to Scan Health Can.
Thanks very much.